Okay, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Just like before, everything's magnified 30 or 40 times on the screen. As we look inside the joint here, the actual joint surfaces don't look too bad. Maybe some minimal wear and tear changes in the cartilage surfaces, but not bad. And then here's where we are going to be focusing on, where this rotator cuff is torn again. And so you can see some old suture material from the prior surgery that you had. But the main thing we're seeing here is that there's just an area of this rotator cuff that's really not attached to the footprint anymore. The biceps tendon's already gone. And so I think our main job today is just going to be to get this tendon securely reattached back to the bone. So right now my shaver is working on what we call the footprint, where the tendon is peeled away from its insertion. And we know from our imaging that that continues all the way up. It's a full thickness tear. So we'll get to work. We'll show you some more in a little bit. Okay, so what we're looking at here, we're in the subacromial space. We can see some evidence of the prior surgery that you had. Here's some suture material coming out of the acromion here. We'll remove that. You still got a little bit of an acromial downsloping here, so we're going to remove this because this little spike could certainly push on the rotator cuff. So you'll see us come in just a minute with a burr and remove that as well. The actual retorn tendon is right here. It becomes a little bit easier to see as we clear away some of the bursal tissue. But now you can see where this tendon is torn. It's a big tear, which is what we expected from the ultrasound we did in the office. Now, as we free this up, now we can see even better how much this rotator cuff is torn below. Okay, so before we get there though, we're going to take off a little bit of this bone right here in the front. Okay, so here's our burr coming in. It looks like some work's already been done back here, but this little anterior portion is what I'd like to address here. I think that'll give you a lot more room and protect the surgery that we're about to do here. Okay. Okay, so here's our tear. I'll use this instrument that you see in a second here as a probe. So you can see this is anterior to the left, posterior to the right. You can see the articular margin. The rotator cuff should be covering up all this kind of yellowish bone. And so we're going to place our first posterior anchor. I don't want to take away any more tissue than I have to. I'm probably going to take away that suture. And remember, we've still got some sutures hanging out here. I don't know if I need to remove those. Maybe we can just make sure they don't impinge on the tissue here by doing that. Okay, so I think those sutures won't cause any problems anymore. But this one I'm going to go ahead and get rid of. Okay, so here's our first anchor in. You can see it's got 3 sutures. We'll take a crochet hook, and then we're going to use a series of what we call suture hooks. We're going to start with a kind of a crescent shaped, or sometimes you call it the straight one. That's going to come in on the right side of the screen in just a minute, but first I'm going to get this blue and white striped suture out to the left. Now we're going to put a grasper in the left and a crochet hook in the, suture hook on the right, guys. Yep, that goes up there, and then straight crescent. Now if you can hold the scope. Okay, so here's my suture hook right here. We'll pull back on the relay. So I'd like to pass a stitch basically back in this direction here to capture that part of the tear. I'm going to use my grasper to help. I want to make sure I get this deep layer like that. See, I got it not quite the way I want it, but now I've got it. Let me make sure. Yeah, that looks good there. So we're going to start way back here. Come to the left. Other. And now you can see that hook is coming all the way underneath. We're going to go ahead and feed the relay. We'll grab that here. And then outside your shoulder, we're going to load that black wire with the blue and white suture. Turn to the left is going to be the next one. Hold that for a second. Okay, now pull straight back. Okay, and so now we'll pull on the relay slowly. You can see how it brings that suture with it. And in a minute, you'll see that blue and white suture dive underneath just like that. And so it's coming out into that blue cannula. We'll get the crochet hook, get the partner suture, and we'll tie this first knot because it'll give us a good anchor point posteriorly. So we're going to come in here. We're going to get the partner blue and white suture. Try and take it in the right order here. And now we're going to tie a knot right there. Okay, so what we've got here is we've got all the sutures passed from the first anchor. Now we're going to place another anchor because we've still got this hole up here to deal with. We'll take the guide and put that down here. So here's the guide coming in again. There's the articular margin, articular cartilage margin. We're going to come back about 5 or 6 millimeters and give enough space from the first anchor here. So I'm kind of liking this position right about here, I think. And you see how we just tap that down into the bone. And then we just magically have 3 more sutures to work with, just like that. And so you can see when I pull on them, see how they pull the entire humeral head, so we know it's secure. So now we're just going to keep doing what we started. We're going to take another suture out anteriorly, which is to the left. We're going to take another turn to the left hook coming in from posterior. Hold the camera there. Coming in from posterior here. Here you can see it. And now let me see if I can position you right about there. We're going to hold this reduced, and we know we want to say we want to repair that right about here. So with a little luck, you'll see the needle tip. There it is. We'll go ahead and feed that through. We'll keep passing these and show you when it's time to start tying them. Pause. Have at it. Okay, so now we're just gathering all the sutures out the anterior cannula. You can see we've got 6 nice sutures passed. We'll pull those 2. Try and take them in pairs wherever possible. Remember, we tied one of the sutures. We've still got one more black and white suture way back here. There it is. This suture is an old suture from your other surgery. I'm going to remove that in a minute too. That's not one that we passed. So we'll take a pair of scissors and we'll get rid of that, and then we'll show you as we tie these. Okay, so we're all done here. We've tied 6 strong sutures. It looks very different because the tear is completely eliminated. Anteriors to the left, and as I externally rotate, you can see the anterior extent. That tendon is nicely tucked down at the footprint here, as you see. And then as we internally rotate, you can see how that's repaired all the way back. And those sutures are just lined up right there, as you see. So that looks good. That's about as good as I can get it for these types of revision situations. But I think that's a nice solid single row repair, and it's not under undue tension, so that ought to have the best possible chance to heal. Now, I've got to do one more little thing that my mentor taught me, a little 2mm punch. We're going to make some little holes in the greater tuberosity. Don't close that one quite yet. And this is going to open up the bone marrow space just to release some of the elements that are important for healing. So we're going to go ahead and tap this down a little bit. Keep going, keep going. Okay, and then we're going to make 1 or 2 more. But there's the first one. We'll make another one over here. We're taking care to stay far away from the anchors. Great. There's another one. And like I said, we don't want to obviously affect the anchors we place, so we may be done here. I think I can get one more way over here. Great. Okay. And so there's our crimson duvet. So we're going to go ahead and finish up here and get you back to the recovery room shortly. As we turn down the pump pressure, you'll see some of the bone marrow elements. Looks like little yellow fat droplets. And you can see them start to come out of those little holes we just made. You see there's another one, there's another one. Those are actually bone marrow proteins and cytokines and other good things, even stem cells. So good luck to you now. Bye-bye.